I'm Awaiz Ahmed, and I work as a consultant spinal and orthopedic surgeon at the Croydon University Hospital in London. I also have my private practice at the Shirley Oaks Hospital and the St. Anthony's Hospital. When I was in university doing my medical degree, I was always interested in surgery and psychiatry. So these are the two fields that fascinated me. So I feel that spinal surgery is actually a combination of the two, where patients have to be very carefully counseled as to what their expectations are and what we are going to be able to achieve by treating them. Not all patients need to have surgery, but there are a lot of issues with the patients, their family stress, work-related stress, and many things that actually contribute to the outcome of the patient. So my job is to actually not only the technical aspect of doing the operations, which is obviously takes a lot of training to get there, but it also involves counseling the patient in the right way so that to kind of figure out who are suitable for spinal surgical intervention versus those who are not, and finding other alternatives for them if they're not suitable for surgery. So this is something which fascinated me, and this is something which I really liked and enjoyed. So the surgical aspect is again it's a very intricate, very delicate surgery. It takes a lot of time and a lot of training to reach there, but once you reach a certain point and you can see the difference your surgeries make, then that's something which gives me a lot of satisfaction. So that's probably a reason why I've become a spinal surgeon. So as a surgeon, I like to see quick results. I like to see the patients getting better. A lot of patients come in with very severe pain. And the most rewarding fact is when I can make a difference to their life, improve the quality of their life. And when that happens and the patients are truly grateful, they come to you and they thank you so much that you made a difference. And for me, it's like a routine thing which I'm so used to. So I don't realize that at times I'm doing something which makes a big difference to another individual, and that's something which is very rewarding for me. Well, I think patients have told me that I listen to them. I let them express their ideas, the thought process. I'm very patient. I don't rush my consultation. I give them as much time as needed for them to give me a clear, concise, precise history. So that's something which the patients always told me, is that I listen to them and always try to work with them. In patients, what I find the most valuable factor is their level of motivation. So I find that patients who are highly motivated and want to get better, they have better outcomes than those who are not. Well, I think the most commonly used thing is prevention is better than cure, because we surgery, any medical problem, before anybody reaches there, we need to be following a principle where we prevent we follow preventive medicine so that people do not end up having medical problems in the first place. For example, with spinal related problems, common things I see is patients having they don't smoking, the lifestyle that they lead, putting on weight early in life. So I see that if a lot of the patients can actually look at the lifestyle and modify it in a positive direction, then the chances of them having to have a major operation are somewhat reduced. And I think preventive medicine is very important in this day and age.